Hi, my name is Latoya. I'm going to be your NP for today. I'm going to be performing a head-to-toe assessment. Let me wash my hands and provide you with privacy. Can you tell me your name?
Henry Campbell.
What's your date of birth?
The 5th of the 20th, 1984.
And why are you here today?
Head-to-toe assessment.
Okay. And what location are we in?
Wyckoff Hospital.
Can you tell me the president?
Joe Biden.
Did I ask you the year? Let me ask the year once again.
It's 2022.
Okay. So patient is alert and oriented, coherent, and his voice is clear. He's dressed appropriately for the situation at hand. I'm going to start off by taking his blood pressure. While I'm testing his blood pressure, setting that up, his skin turgor is less than 3. His skin overall is normal for ethnicity. No scarring or scales noted. He's well moisturized. Blood pressure 120/80. Bilateral radial pulse is a +2, even bilaterally, no deviations in rate, no cyanosis or edema noted to lower extremities or upper extremities. Okay, so his face. His face is symmetrical. His no deviation in nares, no abscess to lips. Lips are well moistened and normal for his ethnicity. Slight hyperpigmentation is noted to the eyes. Sclera is a slight yellow. Brows are even and distributed. Hair is distributed evenly. No crusting. No lice. Eyelashes are also even long and evenly distributed. No crusting or discharge coming from eye. I'm just going to touch your face really quickly. Look up for me. Inner canthus of the eye is pink and moist. Tell me if you feel any tenderness. Maxillary sinus palpation.
No tenderness.
No tenderness noted. And tragus, no tenderness. Mastoid, no tenderness. And no tenderness to the ears as well. So the hairline is slightly receding. Tell me if you feel any tenderness anytime I touch.
No
Any pain?
No pain.
Okay. Slight hyperpigmentation to the neck noted. Beard is full and evenly distributed. Can you puff your cheeks? Can you give me a big smile? Let all the air out. Can you give me a frown? So the facial movements are because of cranial nerve 7, which is intact. Okay. So let's do the eye. Okay. Let's do the vision test, the Snellen, which is this card right here. Can you close your eye and tell me the last numbers that you see? One eye.
LTFPH.
Opposite.
LTFPH.
So the patient's vision is 20/20 without corrective lenses, and the Snellen chart is also a cranial nerve, and that's 2. So this might be a little uncomfortable. I'm gonna shine a light in your eye.
Okay.
I'm gonna be checking for pupillary reflex, and I'm seeing if they're even. Perla intact, around 3 millimeters. Conceptual reflex is also intact. Now, I want you to follow the pen. I'm gonna bring it close, follow. Convergence is also positive. Now we're gonna do the fields, and this is testing cranial nerve 3, 4, and 6. Follow. So those nerves are also intact and no nystagmus noted. Okay. So I'm gonna be looking at your eye really closely. It might be a little uncomfortable. And I'm gonna be shining your light. I just need you to look straight ahead while I shine the light in your eye. This test helps me find symptoms like glaucoma, or it helps me look in the eye to see if there's any damage related to diseases like glaucoma or hypertension. So red light reflexing bilaterally. Left eye disc is well defined. Cup to disc ratio is 0.5, and no AV nicking noted. Let me see if it's the same for the right. And it is the same. So I'm going to be looking at your ears. So the external canal, no erythema or discharge noted, no masses, no keloids. I'm going to look internally. I already palpated for tenderness. So I'm pulling up the pinna, the back. Mild cerebrum noted. Tympanic membrane intact. Cone of light is at 7 o'clock, which is normal. Mild cerebrum also noted. Conal light is stationed at 5 o'clock. And the tympanic membrane is also intact in this ear as well. Sorry. Up here. So I'm gonna occlude this ear and I'm gonna whisper a word and you're gonna say what you think I said, okay?
1, 2, 3. 3, 4, 5.
Okay. So hearing is intact. So this test is called Renee and Weber. It helps me identify if there's any bone or air conduction issues with your hearing. Okay? You're gonna feel a vibration. I need you to tell me whether or not the vibration's even or if it's lateralized or just like in one ear, okay? Okay. You feel that? Can you hear it?
Yeah.
Okay. And I'm gonna do the opposite.
it.
So the Weber test is lateralized. Yeah, lateralized, and AV is greater than bone conduction. Okay. So we did the ears. Let's move on to the nose. So there's no visible drainage to the nose, no dryness. I'm gonna start by inspecting. Actually, let me do the smell test first. And let's test your patency. So I want you to hold your nose one side and then breathe in as hard as you can. Okay, now try it with the other side. Okay, good. Now I want you to close your eyes and tell me what you smell.
Alcohol.
Okay, so that's cranial nerve 1, which is intact. So I already assessed the sinus for any pain or pressure. I'm gonna take a look at the nasal mucosa and see if there's any abnormalities going on. Thanks for putting your head up. So it's pink, moist, intact. No pileups. Same thing bilaterally. No erythema. No excess drainage. Okay. So let's move on to the mouth actually. Use this light and a stick. Okay, so lips are intact, no abscess, no herpetic outbreak. I'm gonna have you open your mouth so I could take a look at your oral mucosa to see if there's any abnormalities. Thank you. Oral mucosa pink, moist, and intact. Buccal also pink, moist, and intact. Under the tongue, pink, moist, and intact. Teeth are in good health. Let's see, gums are also pink. You can put down your tongue. Say ah.
Ah.
So uvula is midline. Tonsils are a +1, negative for exudate, and gag reflexes are also present, which would be indicative of cranial nerve 9 and 10. So I'm gonna take a look at his neck now. So the trachea is mobile, it's not deviated, it's aligned. I'm gonna feel the thyroid to see if there's any enlargement. No goiters noted during the inspection and the frontal. Can you swallow for me? Okay, so again, that's cranial nerve 9, the swallow. And can you shrug your shoulders? That's cranial nerve 8, which is intact. And like he's able to do that against resistance, I would give that a +5 up there. Let's see. Okay, let me just listen to the lungs. Can you breathe in for me? Inhale, exhale. Actually, turn your back so they can see the So vesicular sounds heard throughout. No tenderness while I had this stethoscope palpating on his back because he would have told me. Skin is normal for ethnicity as well. No nodules. We're gonna do a test called tactile fremitus. I'm gonna have you say 99 every time I place my hands on your chest.
99. 99. 99. 99.
So fremitus is felt throughout the lung field, which is normal. Now I'm gonna have I'll percuss. So renaissance sound heard in the upper, but on the lower it's a bit dull to me. I'm gonna percuss the front now. Do you want to turn it the other way? I'm gonna listen to the front as well. Can you just inhale and exhale for me? So lung expansion is even. I'm gonna listen to your lungs as well. In the front. So lung sounds are clear bilaterally. Skin tag noted to upper shoulder, by the way, along with some mild striations to the shoulder area. So lung sounds, there were bronchial in the midsection, then as I progress outward, bronchial vesicular, and then another outward layer, it was vesicular breath sounds, which is normal. So you're gonna turn around the other way and we're gonna do gophme and whisper equality. These are both tests for consolidation. Okay, so every time I place my stethoscope down, I want you to say the word E.
E. E. E. E. E. E. E. E.
So this E is muffled, which is normal. If it was clear, then that would signify consolidation, which we don't have. So now every time I place the stethoscope, you're gonna whisper 1, 2, 3. So 1, 2, 3 was muffled throughout the top, and then as we progress downward, it kind of diminished. Now I'm gonna do diaphragmatic excursion. Well, read them one more time so they can see in the back. Inhale, exhale. So the lungs expand evenly, just so you can see. And since I'm back here, any pain?
No.
No CVA tenderness noted. Okay. It's gonna come back to me. Let me. Forgot what I was supposed to do. Let me just. I don't think I did your lymph nodes. So, lymph nodes are nodules that kind of protect you. When you get an infection or anything, it would swell and be. It would be swollen. You would feel it palpable. So, tell me if there's any tenderness when I palpate. So preauricular,
No.
postauricular,
No.
occipital,
No.
submental,
No.
submantle,
No.
tonsillar,
No.
superficial cervical,
No.
posterior cervical,
No.
deep cervical.
No.
Shrug your shoulders up. Perfect. And clavicle, chain, and no tenderness noted, and patient denies pain throughout. Okay, so okay. I'm gonna listen to your heart. Actually, I did eyes, nose, mouth, ears. I'm gonna listen to your heart. Oh. What happened? I don't know. So. So you could turn this way, let me. So you can see. Yeah. So I'm going to be listening for any bruits, regurgitation, which could indicate a valve issue. Do you have any cardiac issues?
No.
I'm just going to expose your chest momentarily. So, you don't have to breathe in. Just listening for the sounds. Can you move forward to me? Okay. So, no S1 and S2's heard. No adventitious cardiac sounds such as murmurs or gallops were identified like S4 and S3. I auscultated with both sides of the stethoscope. I don't know if you saw that. And while I was with the stethoscope, I was palpating. There was no heaves and no bruits overheard as well. So while you're facing forward, can you smile for me? Cranial is different. I don't know if I did that one or not, but just want to make sure. I also wanted to note that like the AP to lateral chest is 1 to 2. The rate is normal. He's not using any accessory muscles or anything like that. Let me just calculate. Any tenderness?
No.
No tenderness in the chest area or the back, which I already did. No heaves and groups. Okay. So I'm gonna have you lay on your back. Let me pull this out for you.
Yeah.
No, on your back.
Oh.
I'm just gonna go to the other side, so I could like, I'm gonna look at, sorry, pick your foot up. Okay. So I'm assessing whether there's any, can you turn your neck to the side? Any jugular vein distension to the other side? No jugular vein distension noted, no irregular pulsations to the chest wall or to the neck area. Let me listen to it. No brutes heard. Let's see. So I'm gonna listen to your chest the same way while laying down. Can you turn to the side for me? That side. Can you turn to face that side? PMI noted, no heaves, no brutes. Any tenderness?
No tenderness.
And no tenderness throughout exam with stethoscope. So, let's see. Let me go on the other side, sorry. So, is there any way you can come up to the bed? Thank you. So, now I listen to his heart, his lungs. I check for jugular vein distension. I'll check bilateral pulses throughout. So, radial is a +2 even. Brachial is also even. Femoral +2 as well. Popliteal +2. Achilles +2. And the pedal also a +2. Now I'm going to listen to all of them. So both of them are even bilaterally, and I gave them all a rate of a +2. So no heaves and roots noted throughout my inspection or auscultation. So let's do like range of motion if you can. Can you hyperextend your arms like so? Now your wrist. Can you bend your fingers? Can you do your elbows like this? Is there any pain or stiffness during movement? Okay. Can you place them back to your side? Okay, shrug your shoulders. So cranial nerve 11 intact. Can you stick out your tongue and wave it side to side? Cranial nerve 12 intact. Can you just rotate your hips on the bed? Is that easy for you? Okay. Now I'm going to have you lift your legs. Okay. Now rotate your ankles. Then flex your feet upward. Now downward. Okay. So I'm just gonna feel for any, just let me know if there's any pain. And I'm making sure that there's no arthritis, no gout. I'm feeling the MTP, PIP, and MIC. Let me see the other side, please. Okay, thank you. And could you like rotate your arms around the, you might have to stand up for that one. So like for the shoulders? Okay. Okay, full range of motion. No limitation. So I'm gonna palpate your hips, your knees, your ankles, and your toes. Okay. Alright, so I palpated. Let's test your strength. So I'm gonna have you cross your arms, and no matter where I try to move it, just so +5, and we tested the shoulders, that was strong already. Pick your leg up. I'm gonna try to bring it down. Alright. Opposite. Alright. I might have to bring this in so I can do your actual knee. So you can kick up. Okay. So kick up. Okay. Other side. Awesome. Your feet. Awesome. Now down. Down. I'll bring this back in. So there's no limitation with movement, and it has full range of motion. So let's do, you ready to walk? Actually, let me look this way. I'm gonna just expose you for a little bit, sir. So, I'm inspecting the stomach first off. So, there's mouth striation, scant hair, the abdomen is rounded, no old scar wounds or anything like that. Skin is intact and color is normal for ethnicity. It's warm to touch. I'm gonna listen to your stomach's bowel sounds. So bowel sounds are present in all 4 quadrants. Now I'm gonna palpate. So I'm starting off with soft palpation, feeling for any abnormal or masses that shouldn't really be there. Abdomen is soft and palpable. Any tenderness, sir?
No.
Okay. And there's no grimacing look on his face as well. Now I'm going to go into a more deeper palpation. Can you inhale? Exhale. So the liver is non-palpable. I didn't feel any enlargement with the liver as well as the spleen. I'm gonna percuss. So the sound is tympanic throughout the abdominal area, which is normal. Okay. Thank you. So, you could walk in and whoever comes to me. Okay, I'm gonna have you do a walk like you would as, like you're doing a sobriety test, like this, with one foot in front of the other. This is testing balance and coordination. Okay, that's good. Now, I'm gonna have you do you're gonna walk on your heels. Also good. Can you turn around and walk on your toes, please? Okay. So another test is the finger to nose. I'm gonna have my finger out here, and I want you to try to touch it and bring it to your nose. Okay. You could have the seat up here. So his balance as well. Nothing particular. So there's a test that you would kind of on your lap, just like, and see how fast you can go. Flip it and clap it, flip it and clap it. Okay, good. Alright. there's the sensory tests that I have to do as well. So this is going to be testing if your sensations are intact. So you're going to close your eyes, and I want you to tell me if you identify it as soft or hard.
Soft, 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 hard, soft, 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 hard, 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 soft, soft.
Okay, so that's intact. And that's also a cranial nerve as well. I'm gonna test the vibration, and I want you to tell me if you could feel it when I put it on your extremity, okay?
Feel it. Feel it. Feel it. Feel it.
And you felt that in upper and lower extremities. And while your eyes are still closed, I'm going to put something in your hand, and I want you to identify what it is.
It's a pen.
Correct. So I'm going to use the hammer and do your reflexes. Can you, like, go this way so they can kind of see? Okay. Just relax. Good. Okay, so reflexes are intact. I would give it about a 2. Just dangle them. Actually, so I'm gonna take off your socks. I'm gonna basically draw on the bottom of your foot to see how your toes react. Huh? No, just relax. And then, so the toes went upward, which is normal. They fanned out. Actually, they went. Let me do it again. Sorry. Yeah, they fanned out. Okay.
Ticklish.
Yeah. Let me just make sure I got all the cranial nerves. So we tested the smell already, which is cranial nerve 1, 3, 4, and 6, which was the ocular movements. 11, shrug. 12, which was the moving the tongue side to side. Whisper 8, facial 7, gag, reflex 9, and 10, the swallow. And that's about it for today.